We are going to talk about the pollution effect on the pediatric age group, especially when we know that pediatric respiratory rate is high, their height is small, and they have to grow. They are going to live for longer time as compared to adults. So pollution is going to impact them much more severely than the adult. If we start from the pregnancy, once you are exposed in pregnancy, then very high chances of IUG, high chances that your unborn newborn will be allergic later on. Infancy, if we talk about infancy and first year of life, then actually remodeling happens in the lungs and other areas. So it impacts their life for long, especially if there is internal smoking. Nowadays we have got external smoking in the fact that each and every road is like a smoking zone. Overall, it only not affects the patients who already have allergic and asthma, but also a normal human being. It makes the patient child more irritable, concentration defect, eyes problem, nasal discharge, irritation in the throat, continuous cough. Even simple viral infections also become little bit lethal with the effect of the pollution. So how to prevent? It's very difficult, but try to avoid going to the roads in the early morning and the late evening, because that time pollution level is very high. Even if you have to go to to a park or for some exercise, don't be aggressive. Don't induce high respiratory rate, because that will impact the pollution much more severely than a normal patient. And at the most you can wear N95 mask. See, it's all responsibility to prevent the pollution by not having prali and so on. So means at least we can take some of the measures so that we don't contribute as a person to this pollution.